Hello, welcome to this episode of the Partovi Effect. My name is Mrs. Madi Partovi.
And I'm Dr. Ryan Partovi. So really from nutraceuticals, we move on to botanical or herbal medicines, if those are indicated. And really botanicals are interesting because a lot of them have very drug-like effects, but I think, and I think this is a general rule, obviously there's exceptions to every rule, which kind of prove the rule. But because we are looking at millions of years of evolution of animals alongside plants, and specifically mammals alongside plants, and specifically primates alongside specific plants, and you end up with a lot more um, multifaceted effects from a plant medicine where you're going to have a lot of different potential mechanisms of action, a lot of different potential active constituents, components of the plant than you're going to get from the individual element that you might extract and make a drug out of. For example, red yeast rice is a famous example. So red yeast rice contains monocolin K, which is the same thing as lovastatin, but for some reason, at the same amount of monocolin K, red yeast rice reduces cholesterol more than lovastatin does. Why? Well, because there's other elements of it that are also facilitating that process of interrupting the cholesterol production. Now, we could have a whole conversation about how beneficial or not beneficial that is likely to be, and a lot of it does depend on the patient. But the real point here is that if you isolate a particular component, sometimes you get less of an effect than if you do everything together. Sometimes you get more, but it really depends. And sometimes you get more, but with more side effects. So what I would just say is that oftentimes what I find with botanicals is that you get a more subtle effect, a more comprehensive effect, and often a less toxic effect with fewer side effects because there's that coevolution that went on between the animals and the plants and et cetera. So I think that really use botanical herbal medicines whenever possible before going to drugs, with maybe the exception of bioidentical hormone replacement, which we're big fans of and we use a lot in the practice. Because really, if you look at the way hormones, and gets a little bit in the weeds, so I'm going to try to keep it out of the weeds. If you look at the way hormones typically progress as we get older, and for those who are just listening, they just decline gradually and then fall off a cliff around age 50. And really the goal of bioidentical hormone replacement is to prop that level up and have it be more of a plateau. Sorry to be right in front of your face. But that plateau is also having many different effects throughout the body because hormones have many different effects across the body, including antioxidant effects, anti-aging effects. And so if you're not doing bioidentical hormone replacement, you are definitely aging at an accelerated rate because as the oxidative stress accumulates and organ function diminishes, specifically in this case, endocrine organ function, what happens is those organs ultimately reach the tipping point and then they fail. And then you deal with this sort of snowball effect of even more oxidative damage from now unopposed oxidation. So normally you have aging proceeding along at a very gradual rate. And we see this in people who around the time they turn 50, it's just suddenly they get really old pretty quick, right? Within like a 10-year period. And really what you're doing between 50 and 70 makes all the difference in terms of the rest of your life. And so they say, oh, 50s or 70s the new 50. Yeah, 70 is the new 50 if you're doing bioidentical hormone replacement. Because what you're doing is you're extending your youth and your vitality and your functionality through that period. And it's very possible to live into your, easily, I would say, into your 90s and maintain the vast majority of your function if you are taking that sort of preventive, proactive approach. And we see that a lot in our practice. We don't see it as much in the general population, unfortunately, but we do see it among people who really take good care of themselves and are very vigilant and proactive about their health, which kind of brings us full circle. But yeah, I would just say that I think that
See it in me, honey.
in you, yeah, very nice, baby. Of course I do.
I'm not going to drop down a hill. No way.
No way. So that's really looking at a good segue into pharmaceuticals. But is there anything that because bioidentical hormones are not really, I mean, they're made in a lab, but they're identical to the same hormones that our body produces. So they're really not pharmaceuticals in the sense that there are, for example, things like progestogens or conjugated equine estrogens, which are hormone agonists. They trigger the hormone receptor, but they're not hormones, they're drugs, right? So that's a whole different class of compounds that often get confused and conflated with natural hormones. And we could talk about that a little bit if you
And
want to.
they have an impact. I mean, those have a consequence.
Oh, much, much greater side effects, increased risk of cancer,
Yes.
increased risk of cardiovascular disease. Yeah. So I've never prescribed, nor do I recommend synthetic hormone agonists. I think that's
I mean, this is
generally
what
a bad
most
idea.
women think that is available to them.
Yeah.
And it's just, yeah, I want to correct that.
Yeah, or they're getting like just estradiol, which is E2. And the problem with that is unopposed estradiol, if you have any hormone sensitive cancer at all, it's going to just blow it up. And you're not getting all the positive benefits of that estrogen beta receptor activation, which you're going to have with estriol, which is E3. That's our body's natural, basically, phytoestrogen, our body's own phytoestrogen that we produce. We meaning women, obviously, not me. I mean, men produce it to a tiny degree, but women mostly. And estriol is ultimately anti-cancer, anti-proliferative. And if you're only supplementing estradiol, you're not getting any of that estriol other than what your body's producing. But when I'm prescribing it, I'm prescribing predominantly estriol because that's really what I want to have. I want to have that protective anti-cancer, anti-proliferative effect predominating, and then anything else on the estrogen front, specifically the estrogen alpha front, which is the pro-proliferative effects, which can have anti-aging benefits. But again, you got to balance them out with enough estriol and enough progesterone. Unopposed estrogens are not good for anyone, but especially in the postmenopausal woman. So anyway, anything else on either botanicals or BioHRT?
Oh, it's just so fascinating. And so I mentioned our wellness plan briefly.
Okay, go for it. She's allowed to do that. I'm not. Just here. I'm not allowed to. No, I'm kidding.
Well, our wellness plan is so accessible and it includes the guidance with identical or hormone replacement therapy. I mean, I've done the research. I've got some conventional programs that are like 3 times as much that just offer hormone replacement therapy and nothing else. But our wellness plan is so comprehensive.
Yeah. Yeah, we
And
do not only that, but we're also, as I learn new things, they get rolled into the wellness plan. Now we're doing cancer screening.
yeah.
We're checking pretty much all the cancer antigens. I think it's 18 if you're a man, 17 if you're a woman, just because women don't have prostates. But yeah, I mean, it's the most comprehensive form of cancer screening that I've seen. And it's on top of whatever you're doing in terms of whether it be ultrasound, thermography, breast MRI, breast mammogram, whether it be low dose CT for lung cancer, whether it be digital rectal exam for prostate. Even PSA is only one of the 2 prostate markers we look at. We also look at prostatic acid phosphatase, which most doctors don't do for prostate.
It's such a powerful preventive plan. When I get
Yes, absolutely.
these calls from people that are dealing with these chronic health issues and in a dire situation, what if people had access to this, they know about this, they shared about this, that this kind of comprehensive healthcare is available to them? It would alter so many lives. So please share about this. We just recently inflation adjusted the initial investment for the wellness plan, but we're running until my birthday, February 12th, 2025, the original price.
At which point she's going to be turning 22. So great. I just wanted to briefly also touch on why are we doing this cancer screening? Well, we have now seen several wellness plan patients that have mild elevations in one or more cancer antigens, and we do the screening tests and we find nothing on imaging. And guess what? Probably they have stage 0 somewhere, and the imaging just isn't picking it up yet. And so what we can do is we can do anti-neoplastic therapies and reverse it and we actually have seen these cancer antigen markers return to normal. And what I'm assuming is happening there, and what they are often assuming is also happening, is that we off-ramped them from ultimately developing cancer. If they had continued along the path that they'd been on, chances are, more likely than not, they would have ended up developing cancer. But because we're able to get those cancer antigens to come down, I don't think they're going to end up getting it. So look, I mean, some of this is really early days, but I'm just saying there's no reason not to be doing this. But as far as I know, we're still the only game in town. Jon Stewart used to say that ironically, but I'm saying it literally. I mean, I just, there's a couple of tests out there where they're testing finger stick of blood, detect cancer in your blood. They're checking like four antigens. It's like, it's peanuts. That's not comprehensive, but it will give you a false sense of security. Similarly, you could do like an MRI, but then what about my patient with stage 2A breast cancer, invasive lobular carcinoma, that wasn't detected on MRI? It was only detected on ultrasound and thermogram. And turns out she had stage 2A. I mean, if we'd just done the MRI and relied on that, then well, who knows? It could have continued to progress and metastasize and become stage 4. So being willing to look at certain things in different ways, I think, is really important and very valuable. I mean, most doctors, even OBGYNs and even oncologists, don't even know anything about thermography. But thermography is basically looking at the differences in blood flow that happened before and in the early stages and during cancer, such that you can actually detect a precancerous state in the breasts and even sometimes in other parts of the body as well, which then can be followed and tracked and investigated further, or at least addressed so that it doesn't get any worse or even improves.
Yeah, sees it now. I mean, I hear too much that I've told my conventional allopathic doctor that I suspect something's going on, but they keep telling me, oh, it's fine. You're normal. Everything's normal. Come back in 3 months. And then a few months to a year later, they have stage 4 cancer. It's just so.
Yeah, or even not in those like dramatic cases. I mean, I'm thinking of one particular patient where she felt like something was going on in her left upper quadrant. And she
Mm,
talked to several other doctors about it. And then she and I had been working together for, I think, 6 months. And then she finally mentions it to me. And I'm like, well, let's do an ultrasound. Let's just check it out. Right. Then turned out she had some pancreatic cysts. And I said, well, I'm going to send you to, at the time, she was at Johns Hopkins. She's moved since then, but like the national expert in pancreatic cysts, to see whether maybe you have a gene that predisposes you to pancreatic cancer. And so we did the screening, and it turned out she did in fact have that gene. And so then that then raises the index of suspicion. We get to be more vigilant. We get to keep an eye on that pancreas and make sure that if it ever does progress, first of all, we're using anti-neoplastic therapies up front. But then if it ever does progress, we catch it right away and treat it right away. Really dramatically improves the possibility for a positive outcome. So,
the Aspen Wellness Institute medical team will listen to you
yeah,
and will believe you
yeah.
and will do the due investigation, not wave you off.
Yeah. No, you have to trust your patients at the end of the day. I mean, to me, so many patients, even there's a classic example in medicine of like, oh, this person is just worried. We'll just give them some Prozac. My thing is like, even if they're worried, maybe there's something going on, whether it be with their neurotransmitters, maybe it's something going on neurologically. It's worth investigating. If it's in your head, maybe you need to see a neurologist, not a psychologist, right? Because the head is a physical place, right? And it's worth evaluating and investigating just like any other part of the body, just like your liver or your pancreas or your kidneys or whatever else. And so to me, they're all taken equally seriously with an equal level of concern.
Yep. So the wellness plan, save $200 before my birthday on February 12th. You're worth it. You have a right. It is your birthright.
Yeah. Well, what else? Well, I mean, we were talking about drugs. The main thing I would say about drugs is really the advent and the addition of the practice of using repurposed drugs, of using drugs off label, specifically in the cancer context. Dr. Merrick has promulgated this wonderful document, Comprehensive Cancer Care, Metabolic Approaches to Treating Cancer, which has really up-leveled my own cancer care game because we've been doing a lot of natural and integrative cancer treatment over the course of the last 15 years. But what we find over and over again is that the level of compliance required for those approaches to be highly effective is difficult, if not impossible, for the vast majority of patients. Unless you're independently wealthy and happen to have a lot of discipline and a team of people supporting you, it's hard to do the natural cancer therapeutics on your own, for sure. I've had a handful of patients that have done it and very successfully done it. They're still alive today. But the point is, it's not approachable for the average person. The nice thing about using the repurposed drugs, ivermectin, albendazole, mebendazole, metformin, along with some of the natural medicines, curcumin, green tea extract, melatonin, high dose melatonin, etc., is that the combination of these actually has an even greater effect, a synergistic effect, so that you're not having to take as many total pills and powders and everything else. And we're still getting the same great outcomes. So I'm really excited about it. I think it's a new frontier in the integrative holistic oncology world. Most of it can be done alongside chemotherapy, certainly alongside radiation and surgery, and also certainly alongside some of the newer immunotherapies. So that's really exciting to be able to synergize real well with a lot of the outstanding things, and then maybe hopefully to avoid some of them. If you're especially like my personal sort of least favorite is going to be your slash and burn heavy metal based or mustard gas derivative, I should say, type chemo. Big fan, I would say, though, of like the newer immunotherapies and immune modulators, of which ivermectin is actually one. But yeah, I think that, and we could, I'm sure, do a whole series on cancer. In fact, I'm sure we will. But I think that it's worth pointing out that in terms of the drugs, that one of the real benefits of working with a COVID-aware doctor is I'm somebody who's willing to use a drug off label, which increasingly doctors are like, hey, it's not in the formulary, it's not FDA approved for that indication. I can't prescribe it for that. And that's not only hurting the good guys, or what I like to call small pharma, which is the compounding pharmacies, but it's also, I think, hurting patients and worsening patient outcomes. When, hey, I mean, if we can treat somebody with a relatively less invasive, less toxic approach for a few months and see if they improve, and if they don't, then yeah, then we'll try the slash and burn. Like that to me seems like a very reasonable approach, depending on the cancer, right? Sometimes you have a very aggressive tumor that needs to really be treated very aggressively. So that's why having a physician evaluate those things can be really helpful. I would say the majority of cancers are not super, super active. There's a minority that are. I can't tell you the exact percentage, but I would say it's definitely less than 50% that are highly aggressive. And yeah, some of those highly aggressive ones, you got to hit it from as many angles as you can. As Dr. Diadamo likes to say, look, chemo, cancer, they're two prize fighters. And after 13 rounds, a kindergartner could go up to either of those two prize fighters and push them over. We're the kindergartner, right? So if you got a highly aggressive cancer and you've been gone through round and round of chemo, we're very likely that kindergartner that's just going to come and push the cancer over so we can finally get it out of your body. But I think that I don't want to say too much more about that, but right now, but I would just say if you have any other questions or comments or things you'd like to add in. But I think when people think, what is a naturopathic approach to using drugs? Hopefully I've started to open your mind to what that actually looks like, because naturopathic again really means just looks treating the origin of disease. And a lot of people misunderstand cancer care. They think, oh, I have cancer, I need to go on a detox. It's like, no, if you have active cancer, the goal is to make your body as toxic as possible for the cancer. Cancer is a rapidly growing, immunologically disordered growth, which your body has a hard time seeing and a hard time finding and eliminating as a result. And so part of the way we treat it is by making the growth environment as difficult as possible for that cancer. Detoxification is actually about improving health and improving function. The problem with approaching cancer from a detoxification perspective is that you remove toxicity, you remove any impediment to the cancer's growth, you can actually facilitate its spread and growth. If you have cancer, active cancer, the goal is to essentially retox, as Dr. Diadamo likes to say, to make the environment more toxic, less hospitable for that cancer, so that it commits cell suicide and dies. On the other hand, if your goal is to prevent cancer or to prevent a cancer recurrence, then oftentimes detoxification is the correct approach. And I would say usually it's the correct approach and can be very helpful in both preventing cancer and also preventing a cancer recurrence. So getting that subtlety, getting that nuance, really understanding and knowing the difference is where the naturopathic picture comes into the naturopathic mindset comes into play here. Because I think ultimately, that being said, I would say the ironic piece to that is you have so many integrative, holistic, even conventional providers who are well-meaning and maybe they've dabbled into natural medicine and now they're doing a more integrative practice. And even some naturopaths, I'm not going to say this is not the case, will mistakenly approach cancer from that detox perspective, which is, I think it's one of the reasons why, frankly, naturopathic, integrative, holistic, alternative, which I don't really see it as an alternative. I think it's complementary, but non-conventional, we'll say non-conventional cancer care is given such a bad rap, I think is because there is that fundamental tension and confusion there with so many of the practitioners who really, they see cancer as a disorder, right? It's a disorder, yes. There's the normal orderly function of the body has been disrupted, yes, but then they don't go to the full step of really understanding cancer, why it's happening, what's the underlying cause, what exactly do we need to do to get the body to be able to eliminate it or to get it to die off, et cetera. So I think that there's insufficient or incomplete understanding of the disease, which then leads to assumptions made about the best way to treat it. And then that results in sometimes outcomes that are not as positive as we'd like them to be. So that's my opinion. You'll probably get 1,000,001 out there, but I think it's a pretty good one.
Mhm. I wanted to circle back
Sure.
and say one last thing about nutraceuticals.
Sure. Yeah.
That for me, my nutraceuticals and my genotype specific diet is my skincare, is my hair care, and my nail care.
Yeah.
Yeah, I have maybe 3 products that I use for fun, but yeah, what goes inside my body is what takes care of my skin and my hair and everything else.
Yeah. Well, and really health comes from within. Healthy skin comes from within. I say that all the time. And that's the great point. Yeah, thank you for adding that in. And just one more thing that I would say about drugs, and specifically, again, that naturopathic approach to drugs, because in our training, we don't really prescribe a ton of drugs because our preference is like everything else we've talked about up until this point. When we do prescribe a medication, we're trained to really do our due diligence, look at drug herb, drug nutrient, drug interactions very carefully, make sure that, hey, is this really the right medication for this person at this time in their life and with the health issues that they're dealing with. So you'll find that the vast majority of my prescriptions are going to be natural or bioidentical hormones. Like that makes up maybe 80% of my prescriptions, and maybe 20% may be pharmaceuticals. But when I do prescribe the pharmaceutical, you need it, as opposed to, say, someone who you're going to see, and not saying anything inherently disparaging about them, but that's all they do is prescribe drugs. And so they feel like if they haven't prescribed a drug, then they haven't done their due diligence or they haven't given you what you came for. And so then you may end up with a lot more drugs than you actually need for that result or because of that reason. And that's not an issue in our practice. So I would just say that on one hand, you will get prescribed nutraceuticals for sure, if that's something that you're coming to us for. But I would say that when it comes to drugs, I tend to be I have colleagues that don't prescribe any drugs, and I respect their choice. But I would say, amongst those of us who are more integrative and do take the best of conventional and natural medicine, and that is our approach, I would say that we are amongst the most judicious and careful prescribers of pharmaceuticals that I've certainly ever seen. You know, anything else you wanted to say about botanicals, drugs?
No.
Yeah. And of course, there's surgery. I mean, surgery is really a last resort to me. I mean, there's certain really highly operable tumors in certain types of cancer where maybe we'll go to surgery sooner. Obviously, we wouldn't want to wait too long on that. But I would say that as a general rule in our practice, surgery is considered like the last resort for most health issues, certainly non-cancerous health issues. That being said, there's been times that I've referred patients for surgery. So if we've tried everything else, we're not going to just keep spinning our wheels. And look, I mean, that's one of the things I really am straight about with people. I always say, look, I come to us first, for example, let's say fertility, right? That's a classic thing that we treat a lot. We work a lot of people on optimizing fertility because if you look at it from the reproductive endocrinology side, they're not really focused on enhancing their fertility. They're trying to basically to do the pregnancy process for you, to manipulate it to the point where it's the synthetic fertilization process that they're controlling every last bit of. We're just trying to optimize your fertility so that the natural process, which sort of happens really easily for a lot of people, happens easily for you too. Because if you're struggling with it, presumably it hasn't been happening easily for you. And look, if someone works with us for a year and they're still not pregnant, I'm not going to say, well, let's keep working for another year because I'm sure one more year is going to do it. I'm going to say, you should go ahead and start the IVF process and keep doing everything we've been doing because everything we've been doing is only going to help the IVF work better. But it's time to bring on the big guns, right? So, and similarly with certain patients, depending on their genetics, sometimes I'm the one that has to convince them, no, you need a higher dose of this particular cancer drug, or you need a cancer drug, even though you really came to me hoping you could avoid having any cancer drugs. But because of some particular polymorphisms, some genetic differences in your particular tumor, there's this one drug we can use that's actually highly effective and really is a game changer in your particular cancer. And frankly, you probably weren't going to hear that anywhere else other than this. Because if you go to a traditional oncologist, they're going to put you through the system. They're going to put you through, you've got to be on this cocktail of 4, 5, 6 different drugs. And you've got to do it that way because it's the only way to do it because it's the standard of care, the way that's always been done. Similarly, on the other end of the spectrum, that's like, no, never take any cancer drug ever. Well, that's throwing out the baby with the bathwater too. My approach is personalized, customized, individualized to say, look, what exactly is your body calling for right now? You know, what is needed to address this particular health issue? Let's laser focus it, let's target it and take care of it. It's precision medicine, it's personalized medicine. And to me, it's really the medicine of the future today, is how I would describe it.
Fantastic.
Yeah.
Okay. So this wave that we're riding and this new offering, Your DNA, Your Diet, is really geared towards a severely underserved and overlooked demographic that actually cares about finding answers and implementing or taking actions that will guide them through this period of life where, man, it's hard. And I'm talking about women. I'm talking specifically about women between the ages of 35 to 55. okay, where they're going through hormonal changes, perimenopause, menopause, stress and burnout, weight management, chronic stress. There's so many things during this transition period that conventional medicine doesn't really address. And there's a lot of women out there that I know are hunting for information. And so we're going to provide that to you. We're going to provide you not just the education and the information, but a community and an access, like a road to, with grace and ease, take on this transition of your life. And among on that list is like issues with sexual health and intimacy, mental health. So we're
Well,
gonna,
and all of those are also dealt with or affected by hormones and hormone balance, which
yes,
is really the primary thing that's shifting in the time frame that you're talking about.
yeah, bone
And
health,
and
cardiovascular health, reproductive health issues.
yeah,
Yeah,
I mean the things that we address as a practice hormonally, you're you may be wondering, because you said that there's people who do it and they charge more for it. And a lot of times, as I mentioned, they're giving one hormone or two different hormones, and that's it. We look at the whole hormone cascade. We look at what your body is making the sex steroid hormones from. Cholesterol. Is the cholesterol level high enough? People are usually worried about high cholesterol, but what about low cholesterol? Is that even a thing? Your cardiologist will tell you no. I will tell you absolutely it can be a thing. If your blood cholesterol level is lower than 170, it's too low because you're not therefore having enough cholesterol to make pregnenolone. And that conversion of cholesterol into pregnenolone, which is the great grandmother of all of the other sex steroid hormones, is the rate limiting step in sex steroid synthesis. So, for those who don't remember from the chemistry class, the rate limiting step, which means that if that's not happening, none of the other steps after it are going to happen either. And Dr. Shockey would be proud of me for that one. She was my chemistry teacher. So basically, if you don't have enough pregnenolone, you're not going to be able to make enough progesterone, DHEA, cortisol, aldosterone, testosterone, androstenedione, estradiol, estrone, estriol, any of the estrogens, dihydrotestosterone. And we could get into the balance of these different hormones and what all ends up happening in the body. I mean, just we could take maybe two examples, right? So if you get too much estrone as a woman, and especially metabolites of estrone, 16 alpha hydroxyestrone, that could substantially increase your risk of breast cancer. As a man, too much of any estrogen, but specifically estradiol and estrone, or too much dihydrotestosterone relative to your testosterone will substantially increase your risk, not just of prostatitis, but also prostate cancer. So these are just common, not just common issues that are dealt with by men and women as they get older, that as the hormones shift, if you're not looking at the whole picture, I mean, I've seen so many people come in, men on these ridiculous high doses of testosterone, and then they have gynecomastia developing, which is like men developing breasts, because it turns out they have this huge spillover of their testosterone into estrogens, which not only is going to cause breast formation, but it's also going to cause mood swings and increased prostate cancer risk, amongst other increased breast cancer risk. I mean, had a patient recently, a male patient who who's on testosterone is in the midst of a breast cancer scare potentially. So the whole thing here is just you've got to be aware of this ratio. And coming in, I see so many people whose hormones, they're on some sort of hormone replacement, and it's bioidentical in many cases, but because it's not being dealt with properly in the right ratios, you end up with all sorts of side effects and problems.
so the first cut that we're going to take in this program is provide you a foundation, that a foundation of personalized nutrition. Like it will eliminate all the confusion. There's so many women that, okay, is keto the best? Is vegetarian, vegan? We will eliminate all of that confusion because diet is not one size fits all. But exercise is not one size fits all. And we're also going to address, or in community, alongside myself and Dr. Ryan and our nurse practitioner and our wellness counselor, all the mental and emotional aspects of this transition. Because there's a lot. Like, where do women actually go? In Facebook groups? Like this has got to change. And so we are going to provide this.
We're going to provide what?
We're going to provide this through your DNA, your diet comprehensive program, where you will get
Clarity. That's what this, I was trying to figure out what
clarity.
is it when you say
Thank
this,
you.
that's what I was trying to get at. We're going to provide clarity.
Yes.
Yeah, absolutely. So that's such a great point. I was listening to Chris Williamson's show, Modern Wisdom, and he was talking about he feels like sometimes there's all this dietary back and forth and people proposing these different dietary approaches, almost like he wonders if maybe it's not just to muddy the water so that people just say, oh, it doesn't, they get relativistic about it and say, well, maybe it doesn't really matter anyway. I'm not going to worry about it and I'll just eat whatever I want. And that keeps the whole machine running, right? And I mean, I literally wanted to reach through my phone at the time and be like, hold on, I have an answer to that. And the truth is that they're all a little bit right to some degree. And we could get into that. We could do a whole series about like what's right about the vegans, what's right about the carnivores, what's right about the Atkins people and the zone people and all the different other little diets, the one size fits all diets
Yes,
that
but what's right
you
about
see there.
you? Like, what's right for you?
Exactly.
Your
And
genotype,
that's the
your
thing. There is no one size fits all diet. Anybody who says that there's a one size fits all diet has lost the plot.
you scrambled my brain a little bit when you asked, what do we provide? And then I was like, okay, what do you got? A little bit of wordplay. Okay,
I
we're providing clarity, community through a very comprehensive approach.
so my freshman English teacher would never let me write the word this without putting a noun afterwards. He would say this what and put a little red question mark afterwards. So I was this whatting you. I was Tim Haygooding you. Oh.
Ah, okay,
I'm complete. Are you complete?
I'm complete. And I'm
Okay.
excited. I'm
I'm
excited
excited.
for
Look, yeah,
the
absolutely.
new community of women that will be coming into the fold of Aspen Wellness Institute.
Yeah, well, and really taking on this journey because it's a journey and it's an adventure. And taking on this adventure is the opportunity to really get an access to a whole new realm of possibility around health and well-being. And we're excited to share everything, all the tools, the distinctions that we have to share that with you so that you can experience the difference in your life that we've experienced in our life. So this whole series started with a question: why do we eat the way we eat? And hopefully we've answered that because ultimately it comes down to because we wanted to achieve these kinds of results that we have achieved and that we've seen so many times in so many patients. And we want to then also share that with other people. But our desire to share it, my desire, and I think yours too, to share with other people really comes from our experience of the impact and the difference that it's made in our own lives and the difference it's made in our families' lives who have really taken it on, those who have taken it on, and our friends. And then really, I mean, that's what got me excited about going to med school because I'd given up on it. I think we talked about that, but it's like I had basically written off med school at some point. And it was really seeing like this, wait, hold on, this is what's possible. I got to share this with people. That really got me not only excited about being a doctor again, but also excited about the difference that we get to make and sharing that difference with other people. So that's really why we eat the way we eat is yes, selfishly, so we can feel good, and also so that we can be a good example for our children and for our family and friends and for the world of what's possible out of eating the way we eat.
I was tickled just now because your excitement is palpable.
Yeah. Well, I mean,
Ah,
literally, this is the work that inspired me to get through, well, in my case, 5 years of medical school because I did 2 years at conventional and 3 years at naturopathic. Because when you transfer to naturopathic, you have to start botanical medicine, physical medicine, traditional Chinese medicine, and you've got to start all of that from day one. And of course, there's none of that in conventional medicine. So it was supposed to take me longer, but I managed to do it in 5 years, which was a bit of feet. So I have an extra year of med school on every other doctor out there pretty much, but it only added to my knowledge base, if you will. Yeah.
For those of you who are watching on YouTube, do you like our new background?
Oh, we totally forgot to
I
mention the new
know.
background. That's so
Yes.
funny.
I just
Yeah.
wanted to mention that Beauty and the Beast in the back. You got me that for our second or third wedding anniversary, right?
No, I think it was way before that.
Oh, really? Maybe
Um,
first one?
I
Probably. I think maybe first one.
maybe the first one.
First one.
Maybe.
Yeah. But the joke is, I'm the Beast.
Well, the joke is which one of us is Beauty and which one of us is the Beast. I still say she's Beauty, but she likes to say she's the Beast. So,
Well, no, I mean, Stuart made that joke one time.
right.
But he saw my.
Stuart's one of our coaches over the years.
Yes.
He's a good friend and a
He
coach.
saw my dragon fire one time. It's like,
Yeah.
whoa.
She's got a dragon inside of her. It's not immediately apparent, but it's there.
Yes.
All right. We're ready to wrap it up.
We are, yes.
Great. Well, I'm Dr. Ryan Partovi.
And I am Mrs. Madi Partovi.
Thank you for joining us at the Partovi Effect, creating the consensus. Be well.